there could be a reaction.
But not many people seem to have known that until recently, when we were talking about the issues around the soft drinks and benzene and things like that.
Yeah, because it is true. But now, with the current trends of change in the country or all over the world now, people should, if you study the chemistry of some of these preservatives, for example, the benzoic acid that is being used in some of these beverages as preservatives. So if you take it with ascorbic acid, vitamin C, there's possibility of a chemical reaction that will continue to lead to the breaking down of that benzoic acid into benzene, and that benzene is carcinogenic. So by the time the body starts accumulating this benzene in the body system, there could be problems.
That is an example of drug-drug reaction. So if you take in a particular drug, the other one also may contain the same thing, and then there could be an overdose of it.
Then another issue is that some people too, they take the same drug in different names together. For example, let me use the component of a general pain tablet, acetaminophen, called paracetamol, from a particular company to company B, different name, different drugs. So in a situation like that, if one is not really...
Different name, the same drug, you mean?
The same drug, okay. Different name. So, but people unknowingly, they will be taking the same drug together without being knowing that they contain the same thing. And by the time you take this in a volume, in a quantity that is more than what the body requires, then there could be problems. It's a very serious health issue.
Okay, let's talk about drug-food reaction, because there are some particular, food, maybe in terms of fruits, vegetables, or the normal food that we eat, that if you take it with particular medicine, it can also give negative reactions. Tell us about that.
Yeah. There is also drug-food interaction. There are some products that, there are some antibiotics, for example, the penicillin, that it is better taken on empty stomach for maximum absorption into the body system. But there are also some drugs that needs to be taken with maybe fatty food. For example, the new regimen of anti-malaria treatment now, the combination therapy. Most of the, for example, the artemether lumefantrine. So it is always better to use it with fatty food so that there could be maximum absorption. So you can begin to see that there are some drugs that you will get a very big benefit when you take it with food. There are some that will work better when you take it without food, just like I have made some examples.
And then some people say don't take a particular drug with, if you take orange, I don't know, that could also be a factor.
Like some products, like for example, people with ulcer condition, like orange, most of the time, it has a citric acid, contains some acid, and then there are some acidic drugs too that ulcer patients should not really take. So, like, because the moment they take these acidic drugs, it's going to complicate their ulcer condition in terms of so that could also lead to a very serious health crisis in the life of that patient.
Okay, now let's talk about how important it is for the doctor and the pharmacist to work together to ensure that the patient gets the right dose. Because sometimes you visit your doctor and the doctor says, take this amount of drugs or this particular dose, and then the pharmacy thinks a little otherwise. How important is it for them to work together?
The way I see this is that there should be no rivalry between among the entire health practitioners. The doctor, the pharmacist, the nurses, the lab scientists, we should work together for a common goal. What do we want to achieve? We want to see that the awareness of our people, that should be paramount. That we should not, the doctor has a big role to play. Likewise, because they are trained, they understand, they have the knowledge of the disease. The pharmacists too, they are trained in the area of drug application. They know the dosage, the side effect, and the adverse drug reaction that could generate after taking a particular drugs. So I believe the doctors and the pharmacists, even the nurses, everybody should come together under one umbrella so that the patient, which is the main goal, the main target, may benefit maximally from this, the unity among the health practitioners.
Now let's talk about drug storage.
Okay.
Because the condition under which medicines are stored is as important as the medication itself. Let's talk about this.
Storage is very important. If you go through some of, there are some recommendations for the particular temperature.
Okay, if you look at the screen right now, you see this is an open drug market where drug is being sold in the open market under conditions, you know, the weather is hot, you know, whether it's cold, whatever it is, you know, you find people buy medicines from this kind of open drugs markets. How dangerous can that be?
Because these drugs, they are chemicals that if it is not properly stored according to the recommendation of the manufacturer, the potency of, we may lose the potency of this drug even before the validity date, the expiration date that has been given by the manufacturer. Because most of this product could be degraded. That is, the active ingredient could be damaged.
Or they could also even change to what they were not meant to be.
Yes, yes.
Okay, we'll just go on a quick break, and when we come back, we'll talk more about safe medicine use, and we expect that you join us in this discussion.